a YouTube live question answer sessions and case discussion. Today again a very interesting case, again a case of hypocholesteremia. But before that, today is the eve of our master's birthday, Hahnemann Jayanti. So let us remember our master, his contribution to the world in treating the suffering humanity. That is homeopathy, and we are proud that we are following him and trying to treat the suffering humanity through homeopathy. And we have so many cases, right from brain tumors to diabetes to blood pressure to renal failures, that we are able to understand and cure with homeopathy. And that is a tribute to our master, what we should give in his birth anniversary. Of course, the whole life and letters of Hahnemann and his history, maybe I'll be speaking tomorrow. I have 2 or 3 webinars lined up in different academies. But today I just took that privilege of telling you something about Dr. Hahnemann and his life on the eve of his birth anniversary. So the most important thing was that everybody knows that Hahnemann was basically an allopathic physician and then converted to homeopathy because of that one line, that cinchona being bitter in taste cures malaria, and then the whole drug proving case taking drug proving and symptomatology started. We should give first our gratitude to the provers also, who proved so many remedies and they gave so many beautiful symptoms, so that we can cure that symptom what they have told in their proving, and to the doctors who have written so beautifully every symptom. Whenever I cure a case, I thank those provers and the doctors who had taken pains to write those symptoms and write it so accurately that in today's time also, after so many years of the proving, it still is the same and we can relate so many symptoms to that day. As I always say, that homeopathy is very simple. It just requires a proper case taking and the remedy comes out, though not easily, but it depends on your experience and it depends upon your dedication and honesty towards the pathy. So let us start, and let us start the question answer session. Before, if we have a lot of though we have people joining in now, we have a beautiful case. I have a beautiful case lined up. Again, a case of cholesterol. It just came yesterday, but the cholesterol was very high, so the patient wanted to take allopathy, but I told him just wait for 3-4 days, and if you want, you can repeat that and see whether it is coming down or not. So he said, okay, I'll give you 3 days, and in 3 days, if the cholesterol does not show that it is coming down, I will start allopathy. So it's a beautiful case. I'll tell you the remedy also. I'll tell you the remedy also which I gave, and the patient showed good results after 3 days when he checked the report. So I welcome Dr. Alexander, Dr. Smith, Dr. Babel. Hello. So this was a. If you have any questions, you can start before everybody joins in. Then I'll discuss the case. Yes, anybody? Any questions? There are quite a few people online now. If you have no questions, I'll just start one of the questions which I received from one of the doctors. It's a simple case of fever, and if you don't have any other questions, I'll just check. Yeah, we have a question, so we'll take first question. This. So one question: permanent bloating and distension of whole abdomen and weight gain. See, distension of abdomen, as I always say, is a very, very big rubric, and it covers almost all remedies given in the maternity, about 350 to 400 remedies. But as you say that there is weight gain, distension, so it is very tired hangover. So you have to think whether the patient is suffering from hypothyroidism. Hypothyroidism basically causes these type of symptoms where there is a lot of distension of abdomen, there is hangover, there is weakness and all. And that's why the patient has to go for thyroid test and decide no pain but feels full. Yeah. So simple case, if you see whether the patient is suffering from thyroid or any secondary disorder, and Then you have to check the distension. If you cannot get any other thing, feel that distension, some part of the day must be some part of the day too much, and less, and rest part of the day a bit less than what it was, or it is better or aggravated by fasting or eating. For example, if you see when the patient gets up in the morning, and he has a lot of bloating and distension. He gets up in the morning and says, "Oh my God, my stomach is so full and distended." You have to think about 2-3 remedies. The first is sulfur, the second is Naxomic, and the third is Raphanus. Now, Raphanus basically again a very rare remedy, but I have got wonderful results with the Raphanus. Raphanus, that black garden radish. Some people say that whenever in the evening they come home from the office and the whole abdomen feels distended, do think about remedies like Antimicroto, Bryonia or Helleborus. Or some patient will come and tell you that whenever in the night when they go to sleep, the abdomen feels totally distended. Then you have to think remedies like Mac-Carb and sulfur. If you see, sulfur comes in all parts of distension, either morning or evening or night, but then you have to be very sure about it. So some patients come and tell you that there is distension of abdomen before going to the stools, before diarrhea, eating before, eating after. So there are a lot of other permutation and combination. Now even water causes distension, no? So in this case, what happens? Even the smallest food, even the smallest food can cause distension. Now you have to check whether the patient is suffering from some amount of grief or not, because only in those cases when you feel mentally totally full and stuffed up, in that condition you get more distension. And whenever you get those type of symptoms, you have to remember 2-3 remedies which are very, very important. The first remedy is calcarea carb. Don't go to carbo-veg first. First go to calcarea carb. It is a very, very important remedy when there is a constant distension, especially there is a element of grief in that condition, first. And second, if there is an element of anger or something is not happening in that person's life, then the remedy is colocynth. These two remedies are very, very important in these type of cases. Very tired, hangover, especially in the morning. Do think about calcarea carb and do think about colocynth. These two remedies are very, very important. Of course, there is a remedy called as Raphanus sativa. Now, Raphanus sativa also has a very, very important indication of distension of abdomen continuously. So much so that when the patient starts vomiting, the vomit contains a lot of fetid matter, a lot of offensiveness is there. That is a classical symptom of Raphanus sativa. And a symptom of distension also. Sometimes what happens, the distension may be because, whatever I have seen in my practice, distension of abdomen sometimes is because, most of the times if it is constant, it is mostly because of grief. So two things are very important, either calcarea carb, colocynth, Raphanus, and of course then you can have lots of remedies, all remedies like China, like Lycopodium, like carbo, which is there. All remedies are there, but these 3 remedies are very important. First, be very sure that the symptom is primary and not secondary related to some disease. That's important. Can remedies for fasting like constriction, headache, pain in legs? Remedies for fasting like constriction. Whenever you have a problem, whenever you are fasting, so because of fasting you can have lot of symptoms. First of all, lot of people have headache from fasting, as you have asked me. Now if you have headache from fasting, do remember 3-4 remedies, very important. You'll be surprised the first remedy that I put in the chart is not Lycopodium or sulfur. I put it Kali carb. First is Kali carb, second is Lycopodium, third is sulfur, and fourth is phosphorus. And whenever the patient complains of empty feeling in the stomach with fasting, then the remedy should be Ignitia. And a patient comes and tells you that whenever I'm fasting, I start getting headache and I cannot wait to eat the food. Immediately I have to have a food at once. Then the remedy becomes elapse and sanguinaria. So these are the remedies that you should take care of. Malandrinum stops the growth of cancer. I have not seen, Dr. Sandesh, that malandrinum stops the growth of cancer, because I prescribe in cancer if it is very, very particular, like for example, cancer breast. The breast is very hot, discharge, very echorious, very pus, very excoriating, very corrosive, if it's very particular other part. Otherwise, I go in the whole case taking and then prescribe. I have not given malindrinum for stopping the growth. Good afternoon, Dr. Vishaka. Very tired. Okay. Hello, sir. Good afternoon, Dr. Javadekar. Okay. Fatak, there are two rubrics on page 1, abdomen upper and abdomen upwards. Was it different? Upwards mean going up. Like for instance, if you see the Fatak repeat as rubric, coryza descending. Coryza descending. That is from nose to the chest. In the same way, upwards means going up. And upper part is only the upper part of the body. Constipation in fasting. Okay. So if you have a classical symptom like the patient suffers from constipation because of fasting. Now again, see, whenever there is fasting, the most important thing is there is no water taken inside, and the patient is fasting. So what happens? The stools contain a lot of water. The water basically has been taken away because there is no water in the body, and only the solid part of stool is left. In those conditions, you have to think a simple remedy. You can think about Carlsbad. I'm telling you specific remedies. Think about Carlsbad. Think about Senna. Think about when the stools are very hot and dry, alumina, and the fourth remedy is sanicula. Okay, so as we go further, any other question? Yeah, there are questions. Good afternoon, Dr. Aurora. Pain in legs in fasting. See, whenever there is fasting, Dr. Yasin, you must know that the nutrition part of the body is gone. So there is a deficiency of some electrolytes like potassium, like calcium, like magnesium. So it is it's basically not a disease condition. The body is not getting the nutrition. So remedies, rather than give the remedy, just give him an ORS water, a lot of fluids, and the pain in the limbs should go if it is because of fasting. Yeah. So good afternoon, Dr. Vishak, Dr. Jyoti. Dr. Fatak Repetary says a bubbling sensation. Whenever I am taking my life class, I always tell you, or whenever I'm taking now I'm teaching Mater Medica to third year students and the final year students. The first lecture when I went to the students and told that, do you think that the stools are like chopped spinach and the urine is like horse smelling urine, and the taste is like burnt sulfur, and the perspiration is like sulfur. Do you think that these symptoms might be possible? And I have told them, please read these symptoms, because these symptoms basically are there in the patient. The patient tells us, you can interpret these symptoms, and these symptoms are not a joke. These are actually present in the patient. So do remember this. Every symptom is important, and that's why whenever you am teach, because I have seen all the sensation, most of the sensation and symptoms in the patient. So if you tell me bubbling sensation or surf-like sensation or crackling sensation is there in the patient, you can definitely see in the patient. Whatever I have seen in my 21st practice, do believe in all the symptoms present in the book. They are definitely seen in the patient. I can tell you clinically, Dr. I don't know the name, 1, 2, 3, 4, 5. What about renal stones in fasting time? It is usually to drink water during daytime in Muslims. Yeah. See, if the patient is actually a patient of renal stones, we have a lot of patients, actually patients of renal stones, and they come and ask that whether we should have to do fasting or not. So I tell them you can do fasting, because before that you can drink water, and after that you can drink a lot of water to take care of that renal stones and the water deficits. So whatever I have seen in practice, there are only about 5% cases who normally have some pain during fasting, but there is no problem. It is taken care of before and after fasting. Okay. Basically you have to remember, sometimes what happens, people always ask me that if you do fasting, headache increases. If you do fasting, eye pain increases. If you do fasting, stomach ache increases. If you do fasting, we are confused, we are irritable, there is a lot of anxiety, apprehension. I always tell them, all my students, take the opposite, that is more important. Are there some symptoms which are better when fasting? Now that becomes an important prescription point. You always see the other side of the Mater Medica. I always tell them. So, are there any remedies where it is written that fasting ameliorates the complaints? Can you think of the remedies? And this is a very, very important symptom. When you start fasting, And some remedies it is written fasting ameliorates most of the complaints. This is more important than rather than seeing that fasting aggravates headache, or because normally if you are nutrient deficit and the body is demanding types, you have fasting aggravation. But remedies like Conium maculatum, Natrum muraticum, Chamomilla, Zincum, Bryonia, Causticum, these are remedies where it is written that fasting ameliorates. Fasting ameliorates in general. This is very important, the opposite side. Or for example, if you see that the patient is very anxious, a lot of delusions are there, fear are there, it is mostly when fasting. For example, there's a lot of anxiety when fasting. Do remember one remedy, there are a lot of remedies, one remedy very important, and that is iodine. I had a very beautiful case, a very beautiful case. Please, everybody listen to it. The patient suffered from somnambulism, that is walking in sleep, whenever he did not eat food at night. He said that whenever I don't eat food at night, in the same night I start walking. So there were a lot of medicines given before. But he's the patient from my Bombay clinic. So when I went to Bombay, he had come, he had taken a lot of medicine. So people had taken a lot of permutation combination, maybe that he's not eating, so he's feeling that depth, that emptiness is there. That's why to relieve the emptiness, he's walking, XYZ, XYZ. I always say homeopathy is simple. Take what is there in the patient first and see whether it gives results or not. I just took this one symptom, that somnambulism, from fasting. And there's only one remedy, and you'll be surprised, which is the remedy? The remedy is lapis alba. Lapis alba is a very good remedy when the patient suffers from somnambulism because of fasting. I gave lapis alba 1 ml single dose, and within a month that was better. See now, where is lapis alba? We prescribe basically for lipoma. It's almost a specific. But now here in somnambulism, while fasting, lapis alba 1 ml gave me the good results. So this is homeopathy, very simple. See what is there first and then prescribe. Okay. What clawing in abdomen? What is the interpretation? What words? There are a lot of different. There are a lot of different varieties where the patient comes and tells you. Means, for example, if you ask me in Marathi and a patient comes and tells us, द्या असं मला वाटते की असं काय, जसं आमचं गावात असं काय वाघवर येते ना, तर कसं पंजा मारते, असं तसं वाटतं कधी ते मला. It is like that. So clawing pain, and a very very important remedy, you must always remember clawing pain, that is belladonna. In fact, if you have clawing pain in the hypochondrium or the hypogastric or anywhere, first think about belladonna. This is how the patient will come and tell you. The same clawing pain can be in the right liver region, then the remedy changes like medorinum or phosphorus. The same clawing pain the patient tells you in the umbilicus area, then the remedy from belladonna becomes Hiparsalve. So these are the type of varieties of clawing pains in the abdomen where the patient tells you, and you have to interpret that language and then experience in your practice. What is your one homeo treatment by drug transfer, the hair of patient stool while? Yeah. So I have heard about it, but I have no experience. I have never done it. Okay. So here is one more case. I will tell you. The patient came, a very important case of hypercholesteremia. The cholesterol was 252. The HDL was 186, and a very interesting case. See this case: cholesterol 252, HDL also raised. LDL also raised, HDL came down, and the patient came for treatment, and the patient told that some doctor had told him to immediately start on statins. She is a lady of 54 years of age. So she came to us and she said that the husband also came and said that I told him don't take allopathy, I'll treat you with homeopathy, and you wait for 3-4 days and you check the report. If the report does not come down in 3-4 days, you can start statin. So we gave the medicines, and after 3 days the patient checked the report. So after 3 days, see, the cholesterol from 252 came down to 228. The LDL cholesterol was 160, came down to 150, and surprisingly the HDL cholesterol from 36 has gone down to 43. in 3 days of treatment. In 3 days. So this is how a very, I'll tell you the dates also, the patient came to me, and see the dates also is there. 1/4, you can see 1/4, the date 1/4, 1st March. See the date 1st March 2022. The cholesterol was 252 and all. And after 3 days, see the date. It is, can you see the date? It is 5th March. The patient did the cholesterol, and the cholesterol came down from 252 to 228 in just 3 days. Of course, we'll again check the report after a month, and then we'll come to know the cholesterol has come down below 200 also. So this is basically how we get results. If your interpretation is important, you can study a lot of remedies, lot of themes, and thousands of remedies. But if you cannot interpret what is there in the remedy, you will never be able to cure complaints with simple remedies. As I always tell you, basically in cholesterol, I have seen that most of the cases have one symptom in common, and which is that most of the cases in cholesterol have one thing in common. And what is that? Anybody? I have told grief, yeah. So the same rubric I took grief, because grief, accumulation of lot of emotions in the blood, and because of that accumulation, there is deposition of calcium, heart blockages, arteriosclerosis, atherosclerosis, high cholesterol, yes, silent grief. And because of that, what happens? Cholesterol is there. So I went from that rubric, just gave 1 dose of the remedy. The patient checked in 3 days. We have the exact report, the dates also, and the cholesterol has come down from 252 to 228. The most important thing is the HDL cholesterol, HDL cholesterol, which was 36, in 3 days has come to 43. That is important. High density cholesterol has come up within 3 days. And of course, we'll repeat the test after about a month, and let's see, the cholesterol will come to normal, the HDL will increase, the LDL will come down with 1 dose of the remedy. Now just go home and see the rubric grief and understand the remedies in grief, and you will come to, of course, there are remedies which are very common in grief, like Staphylococcus aureus, Natrum pulsatilla, Ambragracia, Caustic morum, Ignitia. But there are some remedies which are again very rare, and sometimes, we have patients where the patient has constant grief day and night grief since years. And a simple remedy, graphitis. A simple remedy, graphitis, which we never think about grief. And it cures the case. Yeah, I normally see what happens, Dr. Alexander. I don't go with one particular small rubric, because if you catch a small rubric, then what happens? You have only 3-4 remedies. So I take a big rubric, grief. Now, big rubric grief might have about 100 remedy, and grief silent will have about 25 remedies. But in this case, the patient was in a lot of grief day in, day out for years. Though she had everything in life, but there was no happiness in life. There was happiness in life. Single dose of graphitis, and see the results in 3 days. And we never think about graphitis in grief, because our theme and our concept in graphitis is something else. But you open the Mater Medica and see graphitis, it's a very fantastic and a very important remedy for grief. That's why I always tell you, just simple Mater Medica, just simple knowledge of the most common remedies, and you can get beautiful results. Like for instance, graphitis, if you see the first line and you get the remedy, suited to women inclined to obesity, who suffer from habitual constipation with history of delayed menstruation. The whole line sums up the summary of the whole patient. This is the importance. And how is the mind of graphitis? Sad, despondent. Musics make her weep. The patient thinks of nothing but death. See the amount of grief. See the amount of unhappiness. See the amount of trauma, the gloominess in graphitis. And that's how graphitis works in cases of grief and grief silent. In case of grief, I would say. So these are very, very important. If the patient is not happy and she's always been taunted and always been humiliated and all, we go to the rubric humiliation and we fail. That's why a graphitis patient becomes very cautious. See how it is a beautiful written in our Mater Medica. Excessive cautiousness. Excessive cautiousness. The cautiousness is so excessive that the patient is unable to decide about anything. The patient can see she's so cautious that she's not able to decide about anything. That's why very timid and very hesitant. Yeah. So this is so important. Dr. Babal has given a fantastic case of that grief. I know he was an amount of grief with many troubles in the family. This is what I want to tell you, everybody. See, every month one new remedy comes and one new theme comes and you again go to that theme and all. Polycrest remedies has everything in that. They have proved at length. Just 3 symptoms: excessive cautiousness, unable to decide. And tell me, anybody, if you come a patient where the patient has a lot of confusion and she cannot decide what to do and what not to do, which remedy will you give? Anybody? Which remedy comes to your mind? Anybody? If you have a case and the patient comes and tells you the patient is very confused, indiscretion, cannot decide what to do and what not to do, which remedy comes to our mind? Most of us will think of one remedy which is very, very peculiar. And which is that remedy? Pulsatilla. Okay. Can we go further? One more remedy. And the patient catches alumina. Okay. Most of the doctors, whenever I ask this question, they give the answer Brata. Totally confused. They don't know what to do, what to answer, where to answer, how to answer. Those are Brata personalities. And that's why most of the doctors think about Brata. But just turn the pages of graphitis, In Brata, it is still the Brata patient takes cold very easily. Same is in graphitis. Same is graphitis. Takes cold very easily. Sensitive to draught of air. That is also graphitis. So, see, they are so close. But just because in repertory, this language is not given. Unable to decide about anything, and that's why we never think about graphitis. We never think about graphitis. I'm just trying to show you symptoms, how to differentiate. There may be a lot of remedies, but of how Brata is given and how graphitis is omitted, that is more important. Otherwise, we always remember one sentence of graphitis, when we were taught in class that what pulsatilla is at puberty, graphitis is at the climacteric. But cautiousness, obesity, constipation, delayed menses, sad, despondent, weeps. Music makes the patient weep. So much sadness. And Dr. Babal rightly pointed out that he had cured a case of herpes zoster, and graphitis helped the patient, and now he remembers that there was a lot of grief in the family. So that is very important. Yeah, and he's so depressed that he weeps with music. This is so important. So one question we have: case of Zenker diverticulitis came to me. What is the approach? Because it is a rare problem, medicine which can be used. Yeah, if it is a rare problem, Dr. Bawas, it is very important that there has to be some rare. It has to have some rare peculiarities in that personality. In fact, just hear what I'm telling you. In fact, if the disease is so rare in that case, that means there is something rare symptom present in that constitution. In fact, the person himself is a very rare person. He has some beautiful constitution, very different from others. Try to find out that difference. That's why it's got such a rare disease, Rare person, rare disease. So that is how you have to identify that rare symptom in that rare disease of the rare personality that makes him different from others, and that's why he's got such type of disease. Are you getting me? So this is very, very important to understand if you're treating a case where the disease is very rare. I hope you understood what I wanted to tell you. try to find out that in your case, taking the rare part in the case, because he's presenting to you with a very rare complaints. Like for instance, I had I don't know where I had told you, I had presented a case of Hirschsprung disease. So we entered the case with a very common symptoms, but very peculiar to the patient, and the whole Hirschsprung disease, which is told to be incurable, cured with a single dose of homeopathy medicine. That is the importance, and that is the amazing what you call thing about homeopathy. Everything, see something rare, see something peculiar in that rare personality and rare disease. After taking bath, patient suffers from fever. See, basically what happens. Of course, if it is very peculiar symptom, then you must take that for prescription. But I have not seen that type of case where the patient has fever after bathing. But then if I was given the case, I would have seen which type of bathing: normal bathing, hot water, cold water, morning, evening, night, and how is the rise of fever. Because normally when we bath with cold water, it is a therapy of treating high fevers, so the fever has to come down. If in your case it is very surprising that the fever goes up, then the type of water and the time of bathing is so important, because it's a very rare and a very contradictory symptom in your case. So you can think about some contradictory remedy, and then you can get to the remedy. Yeah, Dr. Navjot. So, of course, thank you. It's good that so you have to understand that rarity, and I think if you share the case with us, we can also see something rare in the personality and then prescribe the remedy. How can we choose one medicine when person matches nearly two drugs in does not give priority? Yeah, this was a problem, Dr. Chatterjee, with me also, and sometime it does happen. But maybe 15-20 years back, I had the same problem. That when I used to take the case, and I'll be very frank with you, I'll be very frank, because we are just meeting just to discuss homeopathy. So 10-15 years, I also had a lot of problem, and I used to feel that, oh God, in this case, calcaria carb is also there, it's covering the constipation of the constitution, and lycopodium is also there because it is covering the gas part and that part. And I was so confused in giving the remedy, and it would be very difficult for me understanding what to give and what not to give. It happened with me also. So my suggestion to you would be, what I learned from my failures. If you're confused after case taking what to give and 2-3 medicines are coming, I'll not give that cliched answer. Go into depth, go more deep, and in the depth only one thing is there. That is right. But how much deep? How much to ask? That's the second question. So I'll not give you that answer. Whatever you have to do is the most important presenting feature of the patient. The most important presenting feature of the patient from which the patient is disturbed and diseased. Take that, give an acute medicine, calm down the patient. After maybe a week or after 5 to 10 days, again call him, and then again take the case, or what points you have written, you try to identify and again ask the importance and the gravity of that point. At that time, you will come to know the patient was irritable, angry, repulsive, acrid because of the pain, and now actually the patient has become mild, gentle, and you'll say, this is the case. Then go to his sora. Ask him what was in sora, what is in sora. That is very important. And then you prescribe the remedy. This is how you have to develop your practice in life. Don't give mixture of 2-3 medicines, because once you start doing it, very difficult to come out of it. Okay, that is what I have learned in my practice. How to understand miasm in pathology? Any book? No. See what happens. Miasm, basically, if you just read Hahnemann's chronic disease, and basic psora psychosyphilis, keep on reading it every day. There are different authors now. Every few weeks we get a different book. All books basically are from the basic books only, and maybe languages change or the expressions change, but everything is from the basic books. Keep learning from the books. I would not say it is very easy, but it is not difficult also. From the Hahnemann's chronic disease, from that, go home and read, keep on reading those books, and every time you read you get some different concepts, and you can develop that in your practice. Autistic cases, I have got fantastic results. And in autistic case, one thing is very very important, you have to go beyond what the patient is trying to tell you. What will happen? Yeah, just a minute. See, what will happen that in autistic cases, the most presenting symptom, the patient comes and tells you he is very cranky, he is very hyper, he does not concentrate, and he eats like this, he does not listen. Go beyond that. Go beyond that. Go behind it, and you will see there are so many results, so many symptoms hidden behind it. In presenting autistic case, what I believe that if I have an autistic case came to me, I have to have a follow-up at least 10 years to see how does the patient come out from the autistic, and how does he get his education, then career, and then we can say it is a cure. So go beyond what is being shown and seen to you in front of your clinic. That is very important. Can we give both? No, I gave you the answer. Abdomen convulsions, motion, spasms after. What does the mean? See, convulsion motion of abdomen, okay, and spasm, like the difference between epilepsy and convulsions. Same. See, Sir, can you opine? Scleropharia nodosa. Now, okay, next question I'll take first. Just a minute. Senior homeopath. Yeah. See, senior homeopath doesn't like it because normally we are homeopaths, and what happens that in homeopathy it is not good to mix these remedies. So don't do it, because once you start doing it, it will be very difficult for you to come out of it. So what I told you, just make sure that the most important presenting symptom, take that, calm down the patient, and then read, or whatever case you have taken, just try to see the gravity of those symptoms in relation to that, so that you can give importance to those symptoms which are important and exclude which are not important. Okay. So Scleropharia nodosa. Now see, let me be very frank. It's a very very rare. It's a very very rare nosode. I have not used it so frequently in my practice. But few symptoms which I want to tell you, which I would like to tell you, would be in Scleropharia nodosa. I have seen most of the cases elements from vaccination. VX, not vaccination, vexation. Elements from vexation. This is a starting, and I tell you this because when the remedies like which are basically used for vexation, like staph or acid phos or corrosins and all, when they failed, then I started digging up some other remedies. So vexation is the causation of Scleropharia nodosa. Second, despondency, much troubled about the past and very apprehensive about the future. This sentence you have to write down in your books. The patient is very despondent, he is much troubled about the past and very apprehensive about the future. That is Scleropharia nodosa. A very very important symptom. Do write and do remember this, because this has given me very good results. One thing more of Scleropharia nodosa is vertigo when erect. When he's standing erect, he gets vertigo. You got it? It's a very very important remedy for nodes in the breast. For nodes in the breast. This is again a very very important symptom of Scleropharia nodosa. Of course, there is one symptom that you have to remember of this remedy in relation to mind also. Whenever this patient is moving about, he's traveling and all, he feels very miserable. So when we were prescribing remedies for homesickness or pining persons, that time I read this symptom. So these are a few symptoms which I have seen in my practice, and that you also can see. But I have very limited cases to tell you more about this. Of course, then there's one symptom that whenever there is burning of, and when you rub a surface, it becomes, there's a lot of burning. That is also an important indication of Scrophularia nodosa, and it's a very important remedy for pemphigus also. This is something which is very important, which I have found out in case of pemphigus normally. So I have seen this remedy, and it is said that in a maternity that this remedy has a special affinity for the breast. Very like we have sister scan, like we have phytolica, we have conium. These remedies, like they have very specific indication in the breast. This remedy also has the same symptom what I've seen in my practice. Okay, this is something, very few symptoms of Scrophularia nodosa. In Sora, very scared as a child, all the time, aggressive, shouting and digging nails in the arms. As compensation, she would shut down and remove herself from her body. No, I did not get that question, to Alexandra. Shut down and remove herself. No, if the patient is very scared in the childhood, remember that that scared actually is now in the thought process of the patient, in the thought process of the patient, and that from there everything will develop. The scaredness, the insecurity, the humiliation, the mortification, the fear, everything will start from there. So if you have a very aggressive personality like Nanny is there aggressive, this basically is the sufferer. Everything is shut up here. If this aggressor comes down automatically, or this is to a limit where the patient cannot bear it, it becomes rebellious. So two indications we have. Normally we have seen the nanny is there, she goes down or she expires or she becomes very dull, and then the Sora which was suppressed, the symptom which was suppressed comes out in lot many of forms. He can be rebellious, he can be spoiled, he can be very anarchist types, he can be very what you call snappish types, depending on the constitution and depending on the hereditary of the parents, because one of the parents must be like this in order to get that base and then basically come out of that symptom. So this, as always, the Sora is so important because everything is hidden in Sora. Rest, everything develops basically in life. She forgave the Nani. So this is a very important symptom again. It's a very, very parents. So this is a very, very important symptom that a person has forgiven the nanny. Means the patient is so matured first, or the patient feels that it's a time waste to now quarrel with the nanny, or the patient feels as if I have born for something more in life, and that's why what will I do with fighting with the nanny. So there are three permutations. Always there are three combinations: Sora, psychosis, syphilis. See what is the most important and the most important presenting symptom now, so that we can resolve the past. I hope you got it. It is beautifully said. That reliving is relieving. The bloating part. Okay. So this sums up your case very well, Dr. Alexandra. Everything is so hidden and everything was so taken care of. The patient was so precocious, understanding, maturing, that it has filled the stomach, mind and stomach, that mind and gut connection. Everything is resolved at the cost of bloating. So, as I told you, you can take distension from grief and get on with the case. Okay, so it's a fantastic case. It is said that reliving is relieving. A very, very important sentence, a very, very important quote. Please write down in your books also. Abdomen covers but lifts clothes. Abdomen covers but lifts clothes. See, abdomen covers. See what happens. See, some in repertory, in I would not say any repertory, but it is very related to a particular case. It's related to a particular case. If you go and see the repeat, the patient wants the abdomen covered but lifts the clothing. It is the same meaning where it is written the patient is aggravated by touch but better by pressure. The same meaning in Fatak repertory. Didn't know that there was a rubric distension from grief. It's absolutely fine. I have also known so many things which I never thought that were in the books, in the mathematics on the repertory. I keep learning every day, and that's why I keep telling you that. Yeah. So that's why I keep telling you, keep reading. Yeah, I know it is written in Fatak research. The meaning is same, doctor. Whatever. That aggravation from touch and better by pressure is the same meaning of that symptom. Lifts the clothing. Everything is related. It's not like that. Everything is. So I was just telling something about. It did not under. Okay. See, there's a rubric in the Fatak repertory. Abdomen covering. Lift up ameliorates. Means whenever it's very simple. You go the opposite part. It is written in Fatak's repertory that abdomen covering lifting up ameliorates. Or you just see the rubric exactly below that. It must be written abdomen lifting aggravates. So if the abdomen covering, when the patient lifts, he feels better. So the remedy that has to be there, I have not seen that rubric, but the remedy that has to be there in that rubric should be lachesis, phosphorus, belladonna. This has to be there in that, because lifting the abdomen covering ameliorates the complaints, and lifting the covers aggravates would be bryonia. So this is how you have to understand that. It's simple, but understanding is so important. So please explain. Okay, Fatak, this is yeah. Sir, can you tell for chronic gland in their patient is hot and not chronic medicines where chronic gland language is there but patient is hot and not all chilly? Yeah, you can take that. See, glands enlargement. There are so many remedies. If you see the enlargement of glands, there are a lot of remedies. So just by saying that the patient is hot and chilly I would not like you to basically prescribe on that. Okay, if the patient is hot, the remedy is that. But still, if you want a remedy for glands and the patient is absolutely hot, the remedies like pulsatile is there, bratiode is there, bryonia is there, clematis is there. In fact, lachesis is also there, and I think phytolacca is also there. But if you see that the patient is chilly, now that also has a lot of remedies, like bratacarb is chilly, calcarecarb is chilly, mercury is silicea, belladonna, and phytolacca also is sometimes chilly. So if you cannot prescribe only by hot and chilly and glands, there are a lot of remedies, bump on abdomen, pelvis region, thick and back after long hours of journey. Yeah, basically what happens, it is basically pressure symptoms. When there is a pressure symptom, if you're sitting for a long time and there is basically that part is absolutely stuck up and there is no air and everything is there. So some patient reacts and they have a bump on wherever the pressure part is there. I would say don't prescribe any medicine. Just wait for some time. And it should go off automatically. Just keep washing it with the water and that should go. So I don't think it needs any medicines. Yeah, so I hope you get the answer. I don't think it needs a remedy. Tabacum for what? Tabacum. You want the mathematics of tabacum? See, tabacum, if you can write the question again. Now, again, important abdomen hysterical, hysteria. First of all, you have to understand, it's simple. You can think about simple remedies you can take where abrasion aggravates. So you can think of a very simple remedy. You can give her, uh, depending on the area. If the area is very hot, if the area is very cold, if the areas become very rough, the areas become very scratchy. Depending on that, you have to prescribe the remedy. Now, hysterical distension of abdomen, if you go in Fatak, yeah, it is written in the Fatak that distension of abdomen hysterical. Now, there is no cause, there is no symptom, but the patient feels my abdomen is distended, and if you treat this, that is taraxicum, And in taraxicum, if you see, a taraxicum, in fact, in taraxicum, now I'll tell you the answer. There is sensation of bubbles bursting in the bowels. डॉक्टर साहब मुझे लग रहा है कैसी मेरे बुलबुले फूट रहे, सर्फ का पानी कैसा वैसा बुलबुले फूट रहे, मेरा पेट इतना फूल गया है. दिस इज व्हाट द पेशेंट कम्स एंड टेल्स यू. दैट इज टेरेक्सिकम. You hysterical. First, you have to understand the meaning of hysteria, and then gradually from hysteria understand that. Next, whenever the patient is unable to control the emotions, that is hysteria. So one matermedica, tabacum, see, tabacum is, of course, it is nicotine, and whenever if you are prescribing tabacum, there are some symptoms which are very, very important. You have to remember, a tabacum basically is a remedy where the disease originates because of cerebral irritation. Cerebral irritation, and that's why it is always the remedy followed by marked irritation. Cerebral irritation followed by marked irritation. That is tabacum. And of course, because of this, there is death-like pallor, icy coldness of surface. The surface is covered with cold sweat, and that's why complete prostration of the entire muscular system. That is tabacum. In fact, I remember a case where the patient developed a sudden pain on the right side of the head. He used to come and tell me, ऐसे मुझे लगता है कोई मुझे हैमर से मार रहा है, कोई मार रहा है. And that is tabacum. Sudden pain on the right side of the head as if somebody is hammering. And because of the coldness, the icy coldness, the collapse, the face of tabacum is like pale, blue, pinched, sunken, collapsed. These are basically symptoms of tabacum: pale, blue, pinched, sunken, collapsed, covered with cold sweat. That is tabacum. And that's why the patient will complain with the sinking feeling at the pit of the stomach. Sinking feeling. And that's why the child wants the abdomen to be uncovered. The child wants the abdomen to be uncovered, which relieves the nausea, vomiting. That's why, because of the collapse condition, palpitation with violent when lying down on the left side. When the patient turns to the right side, the palpitation is better. This is a wonderful symptom. Palpitation when the patient lies on the left side, better when turning on the right side. This is important. And how is the pulse? The pulse is very quick, full, large, and the hands icy cold and the body is warm. That is basically what you call is tabacum. I hope you got it. There are a lot of other symptoms of tabacum, but this is the basic important symptom of tabacum. I hope you got that. Yeah, dropsy, when you suppress the menses, you get bloating of the abdomen, and dropsy is important. The whole answer is there in your question only. Next, it could be suppression that is called as secondary suppression. Then you have to think about some other remedies. Scrophularia, the rubbing of the skin aggravates is like the badiaga. That is, skin is very sensitive and gets abrasion easily. Yeah, I have not thought about it, and neither I have given badiaga for the symptom, but the symptoms basically correspond to each other very well, so that can be taken. I have not got the results. I have not seen that, but yeah, it is matching with that. Suppressed menses because of OC pills basically is a secondary symptom, but we are talking about the primary symptoms. So you have to think of something else. Okay. So I hope this is menstrual spotting. There are a lot of remedies, Dr. Yasin. I'll tell you one thing. In case of menstrual spotting, you have to think 2-3 things which are very, very important, and those things are: when is the spotting, how is the spotting, And the most important thing is, whenever they're spotting, what are the other complaints? Whether spotting is reddish, it is maroon in color, in the time of day, in the time of night, during exertion, at night, take that symptom for prescription rather than just menses spotting. So before I end, I'll have one more webinar. So before I end, everybody should remember what is written in the epitaph of Dr. Hahnemann's tomb at the Père Lachaise in Paris. It's a beautiful line. Do remember it in your head so that next time you don't have to read that. There's an inscription on his monument at the Père Lachaise in Paris. Remember this inscription. It is beautifully written. I'll read it on the eve of Hahnemann's Jayanti. Standing between the inorganic and the organic world. Standing between the inorganic and the organic world. Uniting them for the benefit of sick. Earning their gratitude. Looking towards eternity. Samuel Hahnemann, the benefactor of mankind. Go home, read this every day in the morning. It is such a beautiful epitaph written. When you read it, you should get that goosebumps on skin, which I am getting it now. Standing between the inorganic and the organic world, uniting them for the benefit of sick, earning their gratitude, looking towards eternity. Samuel Hahnemann, benefactor of mankind. At the Père Lachaise, inscription is written there. Everybody, please go home and read this tomorrow at least few times so that goes in your head. And this has got a very important and a very deep meaning in this epitaph. Before I go, thank you, Dr. 12345, I don't know the name, Dr. Smith, Abdequaem pregnancy with vomiting. Yeah, it is there. So thank you, everybody. Thank you for patience hearing, and meet you in different webinars tomorrow. I hope somebody would be there and hearing me on Hahnemann's life history and the cases and all. Thank you so much.